Hey, everybody. Thanks for joining us again. In this video, I really wanted to highlight basically my thought process as to when a youth athlete or a child athlete may need an MRI. We highlight the knee joint here because it's one of the more commonly injured joints that we see, but these principles can really apply to any joint. So when I see somebody in the office, there are five major things that I'm looking for or thinking about when I'm trying to figure out if somebody actually needs a knee MRI. So number one, are there any abnormalities on the X-ray? Sometimes we can see some bony or even some subtle cartilaginous or cartilage problems on the X-ray, which will tip us off as to whether or not an MRI is needed. Sometimes there's little bone fragments or bone chips in the joint, or you can see a fracture that goes into the joint or into the cartilage. So if we do see any concerning abnormalities in the X-ray, we're very likely to order an MRI. Number two, so when we examine your child, if we notice any significant swelling in the knee joint or what we would call an effusion, that's also going to worry us a little bit. So swelling in the knee joint after an injury is usually from blood, from something ripping or tearing or a bone cracking or breaking. So if we do find a fair amount of fluid in the knee, we're almost always likely to get an MRI. Number three, we're going to look for the presence of any looseness or laxity of the ligaments on examination. Specifically, when we look for an ACL tear, there's a specific test we can do to test how tight the ACL is. If there's any question as to how tight it is or if there's any looseness there, an MRI can definitely help us figure out if there actually is a tear that we need to be worried about. The fourth thing we think about, so when we're talking to you and your child about their injury, we always want to know if there was an acute, sudden, kind of twisting knee injury. You know, if the kid's been running around and playing and their knee's just been bugging them here and there, that's one thing. But if they were totally 100% normal and they were running and they had an acute injury and all of a sudden their knee swelled up, they had pain, those are going to be the kind of injuries that we want to get MRIs for. And last but not least, we want to know if the injury was contact or not. So a lot of contact injuries can definitely hurt if somebody collides into your child or slams their knee or their foot into your child's knee. Those things can definitely hurt, or if your child lands on the ground and lands on their knee. But oftentimes, those types of injuries don't necessarily result in ligament tears and cartilage damage and things that need surgery. They're usually, cause bad bruises and Charlie horses and things. So we can often treat those without getting an MRI. But the thing that worries us the most is if there's a non-contact twisting injury. So if the child was running, nobody was around them, they planted their foot, may or may not have twisted, but just felt some kind of tweak or pop in their knee from no contact whatsoever. Specifically in your older kids, like your high school age kids, those are the injuries that are going to worry us for a meniscus tear, an ACL tear, a collateral ligament injury. So by and large, if that was the case, we're also likely to get an MRI for your child's knee. The good news is most kids that come into my office to see me don't need an MRI, and they definitely don't need surgery. X-rays are almost always usually sufficient. Hopefully this video was helpful to you and can help manage the expectations you may have if and when your child does sustain a knee injury. And hopefully it'll give you a little bit more information to be able to have an intelligent, informed conversation with your physician or surgeon.